The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test you will be given 2 minutes to check your answers.
Now, look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Questions 37 to 42. You hear the guidelines given by the physician to the nurse about the diagnosis procedure of arthrocentesis. You have 90 seconds to read questions 37 to 42.
Arthrocentesis. Arthrocentesis with a subsequent synovial fluid analysis is performed to determine the cause of arthritis presenting with inflammatory signs or joint effusion to diagnose septic arthritis gram stain, culture insensitivity, or suspected crystal-induced arthritis to differentiate gout from pseudogout. Arthrocentesis can be performed for diagnosis as well as medical treatment of arthritis of a joint. Investigation of joint fluid can help the physician to determine the causes of joint effusion or arthritis, such as gout arthritis, infection, and rheumatoid disease. Arthrocentesis can also be effective in relieving joint swelling and pain. Elimination of synovial fluid from the inflamed joint can also eliminate the white blood cells within, which are the sources of destructive enzymes to the joint. Significantly, arthrocentesis can more rapidly restore the health of the joint. The synovial fluid is analyzed for its physical characteristics, such as viscosity and color, and its chemistry, such as protein, uric acid, and glucose, and microscopy of gram stain, white blood cell counts, and differential count. If the sample is cloudy, there is a chance of bacteria, white blood cells, or crystals presence. In the case that the sample is reddish, there may be the presence of blood. Or else, if it's moderately viscous and forms a string longer than 3 centimeters when a drop is expressed into the test tube called string test. The test mainly depends on the polymerization of hyaluronic acid. A less viscous fluid indicates inflammation. The string test will be negative, that is shorter than 3 centimeters, due to dilution of hyaluronic acid by the presence of extracellular fluid into the inflamed joint. Chemical investigation on synovial fluid includes protein, glucose, and uric acid. Glucose is considerably lower with joint infection and inflammation. There will be an increased level of protein and bacterial infection due to leakiness of the synovial membrane, due to inflammation resulting in an increased concentration of plasma proteins. With gout, there will be an increased uric acid. Microscopy. Inflammation results in an influx of white blood cells into the synovial tissue. The microscopic investigation is performed to detect red blood cells, white blood cell counts, and differential counts. This will help differentiate the most common causes of inflammatory infusions, joint effusions and septic effusions, hemorrhagic effusions, and non-inflammatory effusions. Septic effusions may be due to fungus, TB, or bacteria. Septic effusions are characterized by physical appearance. Joint fluid will be opaque. Microscopy. White blood cell counts above 2,000 per cubic millimeter and often above 50,000 per cubic millimeter. In bacterial infections, the neutrophil count is usually above 75%. A high lymphocyte count is linked to mycobacterial infection. An eosinophil count above 2% may be associated with Lyme disease. Gout, pseudogout, rheumatoid arthritis may overlap with septic arthritis explained above, are inflammatory effusions that are characterized by physical appearance. Joint fluid will be opaque or translucent. White blood cell counts above 2,000 per cubic millimeter, but not as high as septic arthritis. Usually the neutrophil count will be in the range of 50%. Bacterial cultures and negative gram stain. Polarizing microscopy displays needle-like monosodium urate crystals in gout or calcium pyrophosphate crystals in pseudogout. When gout crystals seen under a polarizing microscope are birefringent, then they display blue needle-like crystals, parallel to east-west in relation to the polarizing axis, and yellow needle-like crystals when oriented with the north-south polarizing axis. Non-inflammatory or degenerative effusions are caused by degenerative conditions like avascular necrosis, meniscal tear, or osteoarthritis. Degenerative effusions are characterized by the physical appearance of joint fluid will be clear and transparent. A white blood count will be less than 2,000 per microliter per cubic millimeter. Neutrophil above 25%. Avascular necrosis, osteoarthritis, and meniscal tears are differentiated clinically. Hemorrhagic effusions. Normally, hemorrhagic effusions are caused by trauma. Bleeding disorders such as anticoagulation, hemophilia, neoplasms, or neuropathic arthropathy. Hemorrhagic effusions are characterized by the physical appearance of joint fluid will be hemorrhagic, increased red blood cell counts.
That is the end of Part C. You now have 2 minutes to check your answers.